Hydrocephalus. Hydrocephalus is the buildup of fluid in cavities called ventricles deep within the brain. The excess fluid increases the size of the ventricles and puts pressure on the brain. Causes. Hydrocephalus is caused by an imbalance between how much cerebrospinal fluid is produced and how much is absorbed into the bloodstream. Too much cerebrospinal fluid in the ventricles can occur for one of the following reasons. Obstruction. Partial blockage of the flow of cerebrospinal fluid is the most common cause of too much cerebrospinal fluid in the ventricles. A blockage may happen from one ventricle to another or from the ventricles to other spaces around the brain. Poor absorption. Less common is a problem with absorbing cerebrospinal fluid. This is often related to inflammation of brain tissues from disease or injury. Overproduction. Rarely, cerebrospinal fluid is created more quickly than it can be absorbed. Risk factors. Risk factors that can contribute to hydrocephalus include tumors in brain or spinal cord, central nervous system infections, such as bacterial meningitis or mumps, bleeding in the brain from a stroke or head injury, other traumatic injury to the brain. Symptoms. Symptoms of hydrocephalus vary with age. Symptoms in infants may include unusually large head, bulging soft spot on top of your baby's head, downward gaze of your baby's eyes, sunsetting eyes, sleepiness. Symptoms in children and adults may include headache, nausea and vomiting, vision problems, feeling tired, problems with balance and coordination, short-term memory loss. If you are facing any of the symptoms, contact our healthcare provider. The earlier treatment begins, the more effective it is. If untreated, it may get worse over time and causes serious problems.